Rheumatology is a subspecialty of general medicine. Rheumatology deals with the disease of joints, muscles and connective tissues. There are numerous joints in the body. For example, we have got wrist joint, elbow joint, knee joints and several small joints of the hand and ankle joint. These are all the major and minor joints of the body. Several diseases affect these joints, and rheumatology deals with diseases of the joints which are caused by several reasons. For example, rheumatoid arthritis can affect joints. Connective tissue problems like SLE, systemic sclerosis and other myositis like conditions can also affect joints. So rheumatology is a branch of medicine which deals with the disease of the joints, muscles and connective tissues. Connective tissues are distributed throughout the body. Lung, for example, the functional units of the lungs are called acini. The various tissues of the lung are interconnected by connective tissues. The functional unit of kidneys are nephrons. Nephrons are connected by various connective tissues. So, connective tissue is distributed uniformly throughout the body in major organs, including brain, heart, kidneys, pancreas, so many other organs. So, rheumatological diseases affect these organs too. So, rheumatology is a branch of medicine which deals with the diseases of joints, which in turn affects various internal organs, including connective tissues. Rheumatologist is a qualified, trained person who deals with the rheumatological diseases. Rheumatologist deals with arthritis, connective tissue diseases, degenerative joint diseases and muscle diseases and other joint problems, including infection, inflammation and other joint problems, and the internal organ involvement like involvement of the heart, kidney, lungs. Everything is connected with arthritis and this is treated by rheumatologist. Rheumatologist is a person who has a training, special training in dealing with the diseases that affect joints and connective tissues. There are several rheumatological diseases. For example, arthritis. Arthritis means inflammation of the joints. Arthritis can be rheumatoid arthritis, it can be a psoriatic arthritis, or it can be a reactive arthritis, or arthritis caused by connective tissue problems like systemic lupus erythematosus or systemic sclerosis, or condition known as idiopathic inflammatory myositis, that is inflammation of the muscles. These are all the diseases that can cause arthritis. Apart from this, several endocrine problems, including problems of the thyroid gland which is situated in the neck, and other endocrine problems arising as a result of the pituitary gland, and problems arising out of the several endocrine organs can also cause arthritis. Arthritis can also occur as a part of a cancer-associated problems, paraneoplastic syndromes. Suppose if there is a cancer or there is an infection in the body, somewhere tuberculosis, it can cause Ponson's disease or tuberculosis reactive arthritis, something like that. So, any infection, any inflammation, any endocrine problem or any even only viral fever also can cause arthritis. So, these are all the various diseases that can cause arthritis. The symptoms associated with the rheumatological diseases are usually joint pain. Joint pain can be in the minor joint like small joints of the hands. This is the MCP joint. This is the proximal interphalangeal joint. This is the distal interphalangeal joint. This is the wrist joint. This is the elbow joint. So these are all the cervical joints over the neck, and knee joints, ankle joints, hip joints. These are all the various joints affected by rheumatological diseases. In addition to that, these are all called synovial joints. Non-synovial joints also can be affected. For example, the joints in the lobe, spinal vertebral column over the back. There are several vertebral bodies. The vertebral bodies are connected by intervertebral disc. There are several joints in the intervertebral bodies called apophyseal joints, which contain small portion of synovial membrane. So, wherever there is a synovial membrane is a glistening membrane covering the joint articulation of two bones. When two bones articulate, it forms a joint. The joint is lined by a smooth glistening membrane, and the inflammation of this membrane causes arthritis. There are several synovial joints in the body. The inflammation of the synovial joints is called arthritis. Treatment options are aplenty. Unlike 1970s or 80s, where the limited drugs are available to treat arthritis, nowadays there are umpteen number of drugs. They are called disease-modifying anti-rheumatic drugs, DMARDs. These disease-modifying anti-rheumatic drugs will take at least 8 to 16 weeks to act, but once they act, they will start modifying the natural course of the arthritis, and permanent damage to the arthritis, the inflammation of the joints is healed, and the arthritis is going for remission. So the arthritis has to be treated very aggressively from the beginning. Previously they thought you reserve the very tough drugs or very high drugs for severe arthritis, and for mild arthritis you use mild drug therapy. The concept has completely reversed at present. Now they say arthritis is a problem where you have to start the treatment very early, treat it, hit it very early, very aggressively, so that permanent damage to the joints. So nowadays the current recommendation of the international bodies are that the arthritis has to be treated very early, very aggressively with the latest therapy.
What is the latest therapy and recent advances in the treatment of rheumatological problems?
Usually we use synthetic or non-biological or targeted disease-modifying anti-rheumatic agents. Synthetic DMARDs, there are few drugs like hydroxychloroquine, methotrexate, leflunomide, sulfasalazine, and several other drugs are available. Cyclosporine, tacrolimus, sirolimus, a lot of drugs are available, synthetic DMARDs. They take at least 8 to 16 weeks to act. And now there is a new class of drugs known as biological therapy, which has revolutionized the treatment of the rheumatoid arthritis and other arthritis. Now the biological agents, previously they were using the biological agents for severe arthritis, but now the current recommendation of the international bodies like American College of Rheumatology or European League Against Rheumatism, they recommend that the biological agents they have to be used very early in the arthritis so that the permanent damage to the joint is prevented. But the problem here is the use of biological agents are not without any adverse effects. They can cause some side effects, but your doctor will monitor for the side effects and will treat it. You have to get screened for bacterial infection, tuberculosis, several other hepatitis viral infection and several other infections before biologicals are given. And biological therapies are associated with some minor complications which are totally treatable and reversible. But biological therapy have revolutionized the treatment of rheumatoid arthritis. Non-steroidal anti-inflammatory drugs are definitely useful in the initial phase. But suppose somebody has joint pain, it has to be relieved. Simple paracetamol may not be enough. You have to use a non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are not without side effects. They may cause stomach problems, stomach upset. They may cause ulceration in the stomach, gastrointestinal tract. They can cause liver damage, they can cause kidney damage, but your doctor will monitor that. You don't worry that some non-steroidal anti-inflammatory, there is a wrong notion, there is a wrong idea among the common public that non-steroidal anti-inflammatory drugs are always dangerous. It is not so. When used by an expert, knowing your kidney function, knowing your age, weight, everything, when used in appropriate safe dosages, non-steroidal anti-inflammatory drugs are definitely pain relieving, number one. Number two, now they have proven without any iota of doubt that non-steroidal anti-inflammatory drugs also have got some disease modifying and rheumatic properties. So used judiciously, cautiously, carefully in the expert hands, I think non-steroidal anti-inflammatory drugs definitely have a role, because whatever you use, DMARDs, biological or synthetic, it will take some weeks or months to act. Before that you have to use some painkillers. For that you have to use non-steroidal anti-inflammatory drugs. It's a very intriguing question. The heart attack and arthritis, it's a very common. When there is an arthritis in an individual, there is inflammation of the joints. It is not only joint inflammation, there is inflammation of the entire vascular tree. Our body consists of so many blood vessels. Large vessel is aorta, branches of the aorta, carotid arteries, the cerebral arteries, taking circulation to the brain, the arteries to the coronary arteries, everywhere there is inflammation. So arthritis, apart from causing synovial inflammation, causes the dysfunction known as endothelial dysfunction. Endothelium is nothing but a smooth lining interior of the vessels, blood vessels. This vessel inflammation always occurs associated with arthritis. That is why arthritis is not confined to only joints. Arthritis can cause damage to the blood vessels, and as a result it can cause heart attacks or myocardial infarction, or it can cause stroke, or it can cause heart attacks or a stroke, brain attack. It can cause infarction in any organ of the body. Any organ. When the longer the duration of the arthritis, higher the chances of internal organ involvement. Commonly, in rheumatoid arthritis, lungs are involved. A condition known as interstitial lung disease, which has an onset with mild breathlessness, which progresses to severe breathlessness, is a manifestation of rheumatoid lung problem. Other organs like kidney, SLE can cause nephritis, or the drugs you use for treating arthritis may affect rarely kidneys, or it can cause affection of the internal organs, any internal organ, liver, spleen, pancreas, intestines, any internal organ, brain, all this can be affected by arthritis. It is uncertain, because arthritis, you have to take your drugs regularly, continuously, uninterruptedly. That is very important. It is not a symptomatic therapy. It is not just symptomatic therapy, giving a painkillers or steroids when the pain is there or stopping. Some people do that. When their pain subsides, they think they are happy. They take, for example, if a diabetic has diabetes, they take the drugs. When the diabetes is uncontrolled, they stop the drug, and again the diabetes is worsened. The same happens to arthritic patients. They take medications. After some time, when the disease-modifying anti-rheumatic drugs act, they become pain-free. They think the arthritis is cured. They stop therapy. Again, the arthritis recurs and the damage happens. So, the duration is continuous. It has to be lifelong. But with a caveat that it need not be lifelong. Sometimes arthritis may remit on its own for the entire duration of the life. It depends on the individual, his genetic makeup, response to therapy, how regular they are with therapy, what is the therapy given, how effective is it, whether the correct agent is chosen for the therapy and all that. It depends on several factors. Definitely, of course. A person with rheumatoid arthritis or SLE or any other connective tissue problem can get definitely married when the disease is under control. They can get married, they can have children. Only the caveat is the disease should be under full control. Further, they have to take the drugs continuously. They should not drop the drugs. And there are certain drugs which are very safe during pregnancy, lactation and with married life. So a person with arthritis or a rheumatological problem can lead a normal life with appropriate therapy. Arthritis is controllable. Sometimes it is curable on its own, but we cannot cure it. Arthritis can go for remission. Usually, arthritis, when it occurs, if you recognize it early and treat it early, it might remit completely. It may going for a remission. The arthritis may completely disappear, but it may appear again. So arthritis may not be curable, but it is definitely controllable. Once you control, for example, you have diabetes, one can ask whether diabetes can be curable. Diabetes is incurable. It's a lifestyle disorder. The treatment has to be continuous. Arthritis is also like that, but the difference here is that arthritis has better chances of going for remission. Remission means the disease will not be active. The individual will not have any joint pain. The drug-free remission is the treatment aim of arthritis. So rheumatoid arthritis, for example, they have to take drugs for 1 year or 2 years. After 2 years, we will reduce the medications and the disease may go in for remission. The remission can be permanent or the remission can be for a few months or few years. Again it may appear. So arthritis is not curable, but it is definitely controllable and it has to be treated compulsorily. Systemic lupus erythematosus or SLE, commonly or otherwise in popular parlance it is known as lupus. Lupus is a connective tissue disorder. It's an exclusive disease of females. For every 8 to 10 females, one male is affected. It affects younger women, particularly young and Asian people are affected more common. This SLE, there is unusual reaction to sunlight in the skin. There is photosensitivity, burning sensation of the skin with the loss of hair and the face becomes red and the person have multiple joint pains, fatigue, restlessness and there may be an internal organ involvement like there is inflammation of the kidneys called lupus nephritis or it can cause lupus pneumonitis, inflammation of the lung or it can occur inflammation of the any organ or it can cause even vasculitis, inflammation of the blood vessels in the body. So systemic lupus erythematosus is it's a connective tissue disorder of autoimmune origin affecting various internal organs and it is more common in the females. Normally our body handles the protein. Normally the substances we consume consist mainly of carbohydrates, proteins and fats. The proteins are metabolized ultimately into uric acid. The uric acid has to be excreted from the blood. It has to be filtered in the kidney and to be excreted in the urine. Normally the uric acid level in the blood is maintained between 6 to 7 in the males and below 6 in the females. In some people, due to protein breakdown and protein metabolism, either the uric acid is overproduced in the body or normally produced uric acid is not excreted properly by the kidney. So it can be an over excretory problem, over secretion problem or under excretion problem. Both this can cause elevation of the uric acid. In some individuals, the uric acid elevation can cause when the uric acid levels exceed 6.8 milligram per deciliter, it causes supersaturation, hypersaturation of the body fluids. This uric acid crystals goes and get deposited in the joints and it can precipitate a gouty arthritis, which is a very acute, painful, severely debilitating condition causing crippling pain in a joint. But usually uric acid is remaining asymptomatic. This is known as asymptomatic hyperuricemia. Suppose somebody has the uric acid, male has uric acid maybe 7.8 or 7.9, still there may not be any joint pain. That is called asymptomatic hyperuricemia. when the uric acid is more than 7, it can precipitate gouty arthritis. Gouty arthritis is an excruciatingly painful condition. Suppose a young man, young entrepreneur, goes and attends a party in the night. He has a drink, 2 or 3 drinks, or takes a pint of beer, and he returns to his room or home. Then, in the middle of the night, he is getting up with a severe pain over the ankle or knees or insole, and he thinks under the influence of alcohol he has hit some place, and he thought it is due to trauma, where actually it could be due to a uric acid problem. So uric acid problem occurs very acutely within hours. At 8 o'clock he is going to a party, 8:30 consumes alcohol, returns home by 10:30, 2:30 early in the morning he heads up with a severe pain in the joint. That is a gouty arthritis. That is the uric acid problem. Usually, in most of the individuals, there can be only one attack of gouty arthritis in his entire life. But in 10 to 20% of attacks, the gouty uric acid problem causing gouty attacks occur recurrently with more episodes, each episode lasting for a few days. Subsequently, the attacks become more frequent and the duration lasts longer. Established gouty arthritis occurs. So, uric acid is a lifestyle problem, and obesity and consuming a lot of carbonated drinks or eating excessive meat can cause this gouty arthritis. Arthritis cannot be ignored because it produces excruciating pain. It is dealing with your mobility. If there is arthritis, you cannot move. If there is hip arthritis, you cannot walk. If there is knee arthritis, you cannot walk. So arthritis cannot be ignored. First, because it is symptomatic. Most often, 99.9% of cases, arthritis is symptomatic. It has to be treated. If it is left untreated without proper medications, that is disease-modifying anti-rheumatic drugs, if they are not used early, the joint may go for permanent damage. The permanent damage will lead to deformities. For example, a hand like this will become like this, like this. There are multiple deformities. They are permanent and they are incurable, not reversible. Irreversible damage of the joint occurs if there is arthritis remains untreated. Suppose if there is hip arthritis, you ignore. It becomes hip arthritis, hip joints are fused, you have to go for hip replacement. If there is arthritis in the knee, if you ignore it, subsequently you are unable to walk. After some time, the joints go for severe damage, you have to go for knee replacement. So these are the very important causes where the arthritis has to be treated, and if it is ignored, then we have to pay a heavy price for the ignorance of the arthritis. My message is simple. Be alert. Recognize, appreciate and accept arthritis. Arthritis is not infectious. Arthritis is a non-communicable disease. It is a lifestyle problem. It is a problem caused by mechanisms which are not under your control. So there are definite treatment for arthritis. But arthritis treatment has to be continuous, and it has to be done by a rheumatologist, and it has to be properly monitored. You have to be under constant rheumatological surveillance to have a better outcome for arthritis. Arthritic patients need not become scared upon the diagnosis of arthritis. They should tell the rheumatologist clearly what are the economic conditions. Suppose if they are affordable, they can go for high therapy, high cost therapy. Some drugs are prohibitive in the cost, but it is not that they should be used in every patient. So the wide treatment options are available. A rheumatoid arthritis can be treated within 1,500 to 2,000 rupees per month. The same rheumatoid arthritis can be treated by 20,000, 50,000 per month. That all depends on the rheumatologist's choice, your choice. Probably a best rheumatologist is a person who suits your packet and design therapy depending upon the socio-economic condition of the patient. Don't think that only high cost drugs will do the good for you. Even low cost disease modifying anti-rheumatic agents can control your problem and you can lead a normal life. But take treatment continuously and lead a normal life. Thank you.